More than 15 million vaccinations have been given so far, but it's believed that a significant proportion of individuals who are from ethnic minorities are currently unlikely to take it. One cause is people hearing things about the vaccine that actually aren't true.
But I just feel so strongly that we need to make sure we dispel some of these myths.
Recent research has shown that many ethnic minority groups were at greater risk of dying from COVID compared to people from white British backgrounds during the second wave of the pandemic. There's increasing concern about the reluctance of people from groups who are more at risk to take the vaccine.
It's very, very rare for vaccines to have a long-term side effect.
That's what's led to this campaign, which is aimed at individuals who are worried about vaccination.
And so the mainstream press has gone off on a tangent with a story being peddled by the likes of the BBC in attempts at explaining the lack of uptake of vaccinations amongst Britain's black and Asian communities, which is being put down to ignorance. A gullible bunch of brown people who are just easily susceptible to fake news stories. WhatsApp messages and Twitter messages are enough to send them scuttling or running away from the vaccination hubs. You want to know the real reason why black and Asian ethnic minorities are reluctant to get vaccinated? Well, it's the same reason why if you're black or Asian, you very quickly learn to be careful of the police. They're not entirely to be trusted. They've always got an eye on the brown person trying to get them incriminated on something or another. So they're not your friends, not to be trusted. Institutional racism, that's why. Institutional racism, decades of experiencing it. If you're black or Asian, then you will have been on the receiving end of an institutional racism when trying to use Britain's healthcare system, where each negative encounter puts one that further off on wanting to engage with NHS services in the future, just as is the case with every negative encounter with the police. One soon learns that neither are to be trusted. You have to be careful, extra careful. Obviously it's not as bad as in the United States where you get shot, but it's there. Institutional racism, NHS institutional racism, which affects or applies equally to ethnic minority healthcare workers, which is why the death rate amongst them is triple that of white NHS workers. The so-called front line, where BAME workers are used as cannon fodder, thrown onto the front lines, whilst white managers Zoom call their instructions from safe hiding places to their brown cannon fodder on the front lines, as my video from April 2020 illustrated. It's an inconvenient truth that the mainstream press and NHS establishment do not want to entertain is that, as is the case with most British institutions, the NHS is institutionally racist. If you're black or brown, you will have experienced this numerous times that puts people off from using NHS in the future, especially when they come knocking trying to jab a needle in their arms. For instance, I could have dozens of personal experience. They might on their own be small, but cumulatively they affect whether you're going to want to use the NHS services again. For instance, there was a nurse that gave me a scowling look when I went to collect an ECG from the reception at Northern General Hospital in Sheffield. This was some years ago. White NHS staff do tend to look down on brown patients. That's a fact. If you're Pakistani, you're a taxi driver. It doesn't matter if you own a limited company. When they see you, you're just a taxi driver. Just shut up and sit down. What you want? What you coming here to reception? Scowling look. Well, I should have videoed it. In fact, a series of negative encounters prompted me to set up a website a decade ago to try and keep an eye on the racist shenanigans going on in Britain's healthcare system. So it's not something new, but it's been going on for decades, with countless studies pointing to endemic NHS institutional racism. We're only now in the wake of a high number of BAME deaths that some are putting 2 and 2 together and starting to ask the question, after all these deaths, all whilst the gullible fools in the mainstream media continue with the BAME community must ignore fake news and get vaccinated. It's not fake news. That's not what they're reacting to. It's decades of institutional racism. And here's another example. I started receiving letters from my GP practice some years ago asking me to go and get a routine blood test done. So when I had it done and went down for feedback from the white GP, he was more focused, rather than dealing with the blood test, he was more focused on asking me why I had the blood test done in the first place, since according to him the levels looked okay, within reasonable for age. Basically, I was being told off for going and having a blood test done and wasting his time talking about it with him. This is why Asian and black patients are at the back of the healthcare queue, because they tend to get treated when they only turn up in A&E in a dire state. So now what do I do when I receive letters and text messages from the GP practice every couple of months or so for the past couple of years? So stating that I'm overdue for a routine blood test. What do you think I'm going to do? Am I going to call them up and book it? No, I just ignore them. I'm not going to go through that crap again. The NHS is institutionally racist to its very core, which is now manifesting itself in the reluctance of BAME community to get vaccinated, which I'm sure is great news for all the racists on the likes of Twitter, busy posting their delight. If they don't want one, then don't give them one. Yeah, they don't want one because they don't trust what's going to be stuck in their arms, not when you've told them to get lost for decades. The only response black and Asian patients have to an institutionally racist NHS is to avoid using it as much as possible and maybe go private. Have private health screenings, which I've done. Have private blood tests, which I've also done in the past, but not for the past couple of years though. Because black and Asian people just do not trust the NHS. It's through experience of trying to use it. And that is why black and Asian people are reluctant to have the NHS stick needles in their arms following decades when they have been basically given the message to get lost. Their symptoms ignored and dismissed. The NHS is not for you. Just now, that same NHS wants to welcome BAME community into the bosom of its arms to stick needles into them. So no, it is not ignorance. It is not fake news. Instead, it is a function of decades of having to deal with institutionally racist institutions, NHS institutions, that cannot even look after its own black and Asian healthcare workers. So what hope do black and Asian patients have? The NHS is not for black and Asian patients. Never has been. That is the clear message from decades of experience of most who have tried using it. Whilst my take on whether one should have the vaccine or not is to ask yourself the question, do you personally trust the NHS to stick a needle in your arm? And then you will have your answer. Personally, yes, I will get the vaccine, but not at my GP and not at any NHS facility. Maybe at a local pharmacy, as I had done for my flu jab.